Hi everybody, welcome back to Anatomy 2 Lab. And today we're going to take a look at the heart. We're going to use this sheep heart as a model of dissection. And the first thing that you will notice is that this heart has all the pieces we talked about in the presentation. So if you remember from the presentation, there's one side of the heart which is going to feel firmer to the touch, and the other side which is going to be a lot squishier, okay? And the squishier side is always the right side of the heart because we know that there is less muscle on the right side of the heart. There's less pressure to overcome, so we don't need that extra muscle. So the part of the heart which is a little bit easier to bend and manipulate, this is the right side. So this is our right ventricle. This is our right auricle of the right atrium. On the other side, we've got the left ventricle over here. We've got the left auricle of the left atrium over here. Now, the very tippy tip is the apex, and this area on top that all the great blood vessels originate from is called the base. I know it's a little bit, seems a little backwards to have the base on the top of the heart, but there you go, right? Welcome to anatomy. So now blood vessel wise, there's a big, large blood vessel right here. If I drop the probe in, it naturally wants to fall to this side, to the left side of the heart. So that lets you know right there, this must be the aorta. Now behind it, there's another big blood vessel right here. If I drop the probe in, it naturally wants to fall onto the right side of the heart. So this must be the pulmonary trunk. So if I drop this probe into the aorta, and I take a second probe and drop it into the pulmonary trunk, you can see that the aorta is a little bit more anterior. So here's a mnemonic for you guys. In the anterior presentation, the aorta is more anterior and the pulmonary trunk is more posterior. So A and A, P and P, okay? So we have our aorta, we have our pulmonary trunk. Now, over here, this entrance going into the left auricle and atrium, this is where the pulmonary veins are going to bring back the blood from the lungs, right? Dump it right into the left side of the heart. On the other side, on the right side, this opening over here, let's see, where do you go? There we go. This opening right here is going into the right atrium. So this is where the superior and inferior vena cava would drop their blood load. So inferior vena cava, superior vena cava meeting in here. Pulmonary trunk, aorta, pulmonary veins, okay? If I flip the heart over so you can see the posterior view, then you can get a little bit better idea about the blood vessels that go to and from the lungs. Right here, pulmonary veins would be letting in, and then right here, superior inferior vena cava. Going down here, pulmonary trunk, in the front, aorta. Posterior view, anterior view. Okay, and that is the external anatomy of the heart. And we'll come back and we'll do some internal anatomy momentarily.